And I want to introduce next a very singular volunteer who has been at the work of this organization for a long time leader, a former state president, a former president of the Retired Teachers Association of Rhode Island, which is our affiliate. And some people don't know, but AARP started as an offspring of the National Retired Teachers Association. So we're always very proud of our education members. Ann Gardella of Middletown has served on so many boards and so many commissions in the work of getting us to a better healthcare system, and one that will represent the best in long-term care, that it would take too long to enumerate all of them. I just want to say, she is the lady you go to when you need something to get done. Whether it is serve on a board, whether it is to lead a group like the Circle of Scholars at Salve Regina University, where she served as the first president. Her achievements go on, and she knows this field as it applies to Rhode Island in great depth. I won't take any more of her time. It's an honor to present Ann Gardella.
Thank you, Kathleen. I'll sit here. Many people sitting in this room were with me in December of 1996 when we were sent to the University of New Hampshire to study dual eligibility, Medicare and Medicaid, and we're like, what is that? So we went to this conference, and from that day on decided that we didn't know anything about healthcare in Rhode Island. And since then, I have said to the AARP staff that Rhode Island is way ahead of the game when it comes to healthcare. What happened after that meeting at University of New Hampshire was we got together with the Department of Human Services, Department of Elderly Affairs, and then called MHRH, and decided that we wanted to learn all about healthcare. And so in January of 1997, we began what we called ourselves an AARP Long-Term Care Task Force. And we began meeting on a monthly basis, sometimes on a weekly basis, with consumers, with nursing home directors, with hospital executives, anybody involved in the healthcare field. And we learned about what was available and what we thought should be available. And one thing that came out of all of these meetings was the fact that as we age, and as Kathleen said, I've been doing this a long time, and we decided that we wanted to be able to be aging in our homes. We didn't want to be in a nursing home. If we had to be, that's a different story. But if we had suitable health, we could be in our homes and have a quality life. And so from 1996 until 2000, we worked on what it was called shared vision. And we came up with this mission statement, or this vision. Rhode Island will have a dynamic, long-term care system that supports high quality, independence, choice, and coordination of services with the necessary public and private funding. And that took us a long time to come up with, but I think most of us that served on these committees, on this committee, still believe that that's the way we want to go. Therefore, the fact that AARP is fighting to ensure that all Americans have the right to medical services is to be noted. Its surveys show that 89% of Americans 50 and over say that they want to live at home for as long as possible. I don't think there's anybody in this room who doesn't agree with that statement. We need to work toward being independent. we need to be training people who will stay in our state so that when we, and I'm talking about me, when we need help, the help is there. We need people that can come into our homes and fit the home so that if we need a ramp, if we need to get rid of thresholds, it's done. And as long as I'm able to walk and talk, I will be fighting until this issue is in place and every American has health care. Thank you.
Thank you, Ann. We are trying new ways to do this forum, so I leave it to the panel to decide whether they prefer to speak from the podium or from their seats. They have the little wiry mics instead of walking around with the handheld. So the option is yours, panel.